regarding protocols for therapy, has a lot changed worldwide in the last 5 or 6 months since we last conversed on this medium. And generally, what has been your advice apart from isolation? What would be the protocol with respect to medication and precautions? So if you can just elaborate a little more on what you were mentioning in terms of protocol and prescription, etc.
Yes. So over the last 6 months, there's been a host of scientific discoveries in this field. One of the few successes, and I mentioned few because most of the trials have been negative, has been the development of an antiviral. It's called remdesivir, and it's now FDA approved. It's approved for patients who are admitted with a drop in their oxygen saturation levels. And unfortunately, the benefits are not that great. It does not change mortality. It does not change your chance of going into the ICU. All it does is it improves the duration of symptoms and cuts your hospital length of stay. So recognizing that, it's part of our protocols now that if anyone is admitted to the hospital or into the ICU, we would use this medication unless there's a contraindication. Contraindications are essentially if you have underlying kidney disease or liver failure. But again, this is not a golden solution. It will not help save. It has not been shown to save lives or cut the risk of being on a ventilator. It helps you in terms of getting home quicker, getting a fever curve better. The other big therapy that has shown to be of benefit is steroids. And this we knew from non-COVID data as well, but if a patient is admitted with pneumonia and COVID, giving them steroids helps. A large component of how COVID makes us ill is by uncontrolled host immune response, and the steroids help mitigate that and improve. This one actually has been shown to improve mortality. There have been a lot of other studies that have unfortunately been negative. Convalescent plasma has been studied, and negative antibodies. One of the Eli Lilly trials that was done has been cut short because of pre-trial absence of efficacy. There's tocilizumab, which was an anti-IL-6 inhibitor, has had a negative study. And there are a bunch of other studies which have been even stopped before completion because of pre-trial absence of benefit. So unfortunately, 2 drugs out there, and one of them, remdesivir, has been shown to only cut hospital duration, no change in major outcomes.
Very interesting for those thoughts. And in fact, somebody did ask on the chat about the Eli Lilly efficacy. So thanks for answering that.